In the previous segment, Dr. Wakefield explained the concept of herd immunity. In this segment, he discusses the consequences of vaccination, promises made and broken, true herd immunity won and lost.
The other thing that was corrupted by this process was maternal immunity, rendering babies most susceptible to measles because vaccinated mothers did not give them passive immunity, creating a somewhat of a nightmare scenario. Let's just say we stop vaccinating tomorrow. We just said, okay, we're going to put this all on hold and see if we can correct this. Measles comes back, but babies now have no immunity. And they're the ones most susceptible to death. What do you do? I mean, look at the nightmare situation that has been created by those promises, by that certainty. What's happened in the real world? Let's look at what happened in the real world. When the vaccine was introduced, there were occasional measles outbreaks. So in the 70s and 80s in the US, the outbreaks were in school-aged children, where they were historically, when measles was still a relatively safe infection. These accounted for the majority of reported cases. Of those, 42% of the children, the affected children, had been appropriately vaccinated. So there you go, there's your first flaw in the argument. These children did not have lifelong immunity from vaccination. 42% of them then went on to develop measles during the outbreak. This is what happened during, this graph shows data for the US in blue and Mexico in green. And you see, as they always show you, this decline in measles incidence. This is not mortality, this is the number of cases occurring year on year. You see this decline in the number of cases. And then it plateaus way down close to zero. What's interesting about this is that you see where measles vaccination was introduced in Mexico much later than America, but there has also been this decline in the number of reported cases. What does that mean? It can't have been due to the vaccine. What it's due to is the fact that it's becoming a milder and milder infection. And these are reported cases, so a doctor has to recognize it as measles. But what if it's so mild that the child doesn't even notice it, the parents don't notice it, there's no rash, no fever, or it's just a sniffly nose? That's what was happening. And this was becoming a subclinical infection in many children, and the Mexican data confirm that. So it wasn't that they weren't susceptible or getting measles, but it was so mild that it wasn't being reported as measles. So over time, here is more evidence that the disease was getting more and more mild. And then suddenly, later on in the late 1980s, 1990s, there's a resurgence of measles. Measles comes back. 1989 now, there were 170 outbreaks in school-aged children. This increased through 1990 with the majority of school-age and now college-age students. So you're starting to see the susceptibility, the age of infection being displaced into an older age group. And in this group, 80% had been vaccinated. Again, this is really quite alarming. That promise of protection for life, like natural measles, simply wasn't true. There was an outbreak in 2 Texan schools, despite 95.8% of the children having vaccine-induced immunity, which clearly didn't work. And the conclusion was that epidemics of measles can be sustained in school-age populations despite very high vaccination rates. So one dose did not protect in the way that natural measles protected. And then later, in that same epidemic period, there was a dramatic shift to preschool children. So again, the great fears of Sir Graham Wilson and Enders were being realized. The age of susceptibility was being changed by virtue of vaccination. 81% were immunized. In 1990, it was now highest in children under 1, where it starts to become dangerous. Among the affected children, 15 months to 4 years, 40% were immunized, and the death rates, not surprisingly, were highest amongst the younger children. So there are now deaths from the resurgence of measles in highly vaccinated populations. And the shift in age, and therefore the morbidity and mortality, are in some way a consequence of vaccination. Anti-vaxxers are being blamed for this. It's nothing to do with being anti-vax. Vaccination has destroyed natural herd immunity. It's destroyed the maternal passive immunity, and it's destroyed the lifelong immunity that would be available from a natural infection, because it does not work for very long. So vaccination has destroyed natural herd immunity.
Vaccines have destroyed true herd immunity by destroying individual, lifelong immunity and maternal, cross-placental, and breastfeeding protections for infants. The fourth segment of Dr. Wakefield's presentation addresses viral resistance and vaccine virus transmission. Hear Dr. Wakefield in person by attending the November 1st and 2nd Your Health Freedom Symposium in Salt Lake City. Register at www.yourhealthfreedom.org.